Hello, my name is Jessica Hicks. I am a MSN Family Nurse Practitioner concentration student at Eastern Kentucky University. Today I'm going to be discussing how adhering to a low-sodium diet can better control hypertension. Hypertension can be categorized into stage 1, which is a systolic blood pressure reading of 130 to 139 millimeters of mercury, and a diastolic blood pressure reading of 80 to 89 millimeters of mercury, or stage 2, which is a systolic blood pressure reading of greater than 140 and a diastolic blood pressure reading of greater than 90. The AHA has stated that 1 in 3, or 75 million people in the United States, have a diagnosis of hypertension. With these statistics, it is essential for the advanced practice nurse to not only treat the hypertension medically with the use of antihypertensives, but it is crucial for the advanced practice nurse to educate the client on the lifestyle changes needed to better control hypertension. The purpose of this project is to assess the use of a low-sodium diet of less than 1,500 milligrams of sodium in adults 40 to 80 years old to better control blood pressure readings. The supporting literature shows that adhering to a DASH diet or a Mediterranean diet, both of which focus on eating a diet high in fresh fruits and vegetables, whole grains, and low sodium, can lower systolic blood pressure. Nassim et al. And J.Hicks et al. Showed that adhering to the DASH diet decreased the systolic blood pressure readings ranging from 2.197 millimeters of mercury to 20.79 millimeters of mercury, respectively. Toledo et al. And Dominic et al. Showed adhering to the Mediterranean diet had a slight decrease in systolic blood pressure readings ranging from 0.72 millimeters of mercury to 3.14 millimeters of mercury, respectively. The proposed intervention for this project is to gather participants that will adhere to a low-sodium diet of less than 1,500 milligrams of sodium for 12 months, utilizing an APN-approved grocery list and a food log diary, which will track daily sodium intake. The participants will then report to the Kentucky One Health Primary Care Associates Clinic in Lexington, Kentucky, once a month to have their blood pressures recorded, as well as their food diaries reviewed for the 12 months. At the end of the 12 months, the baseline blood pressure reading will be compared to the average of the blood pressure readings taken over the last 12 months using a paired t-test, which will evaluate the differences between the readings. The greatest proposed outcome measure is to have a decrease in the systolic blood pressure readings. In closing, the advanced practice nurse must treat a client's hypertension with antihypertensives, but it is also appropriate for the advanced practice nurse to educate clients on how to make lifestyle changes, such as a low-sodium diet, in order to better control their hypertension.